Occlusion, malocclusion, and the various types of methods used to classify the malocclusion. So, first of all, we must understand what is occlusion. Occlusion is when the teeth in mandibular arch come into contact with those in maxillary arch in any functional relation are said to be in occlusion. Now, this is by Wheelers. Now, what is malocclusion? We constantly talk about malocclusion in ortho. So, malocclusion, it is a condition where there is a deflection from the normal relation of teeth to other teeth in the same arch and or to teeth in the opposing arch. This is by Gardner, White, and Lincoln. Now, according to Wheelers, the term occlusion not only refers to the contact at the occlusal surface but also to all those concerned with development and stability of masticatory system and with use of teeth in oral motor behavior. All right, so basically what I'm trying to say is that the term occlusion, it is not only referring to the contact or the occlusal surface, but it is also referring to the development and the stability of the masticatory system with use of the teeth for the oral motor behavior. Now, basically it is the static relationship between the incising or masticatory or occluding surfaces of maxilla and mandible teeth, maxillary and mandibular teeth, or tooth analogs. Now, to classify, we can classify it either qualitatively or quantitatively. Here we can talk about Engel's classification, then we can talk about Simon's classification, then we can talk about the cat's premolar classification, then we can talk about the classification, incisor classification, then we can talk about Bennett's classification, then we can talk about skeletal classification. Quantitatively, basically, power index, IOTN, malalignment index. Then we can also classify the classifications on the basis of intra-arch and inter-arch. For intra-arch, we can do sagittal, vertical, rotated, and transposition. Intra-arch means either individual or group of teeth. This is labioversion, linguoversion, mesioversion, distoversion. In vertical, supraversion and infraversion. In inter-arch, we will discuss them according to the planes. So for the planes, sagittal, vertical, and transverse. Now, sagittal, basically class 2, we will talk about it. Angles class 2 and angles class 3, malocclusion. vertical. So deep bite, open bite, transverse, cross bite, scissors bite, midline shift. All right. So these are the classifications of the classifications. Then we'll talk about individually about all the classifications.